Hi, I'm Dr. Kish with our Med-Minute question of the week. This week's question is, does growth hormone therapy and peptides remain effective for men over 50? That's a great question, and honestly, that's mostly who it's targeted for. So growth hormone is a hormone that's analogous to testosterone. It's at its highest in our teens and 20s and then starts to drop, parallel to basically testosterone. And growth hormone helps with joints, it helps with tendons, it helps with muscle tone, it helps with fat breakdown, but it's really an anti-aging one too. It keeps the integrity of our skin good, plus our mind. It has a lot of mental components to it. So we want to keep it up and elevated because that's really where we get our best benefits and we feel our best with that. So growth hormone goes down. As we optimize people when we're fixing their testosterone, that's generally the next thing that we increase because people are working out or just want to feel better, and it helps people lean down. It helps them get their body back in shape. When we look at those things that are going to increase growth hormone levels, there's actually human growth hormone by itself that people can take, or there's things that stimulate that called secretagogues. Those are things like CJC 1295, Somorelin, Ipamorelin, and Tesamorelin. What those compounds do is they actually stimulate your pituitary to release growth hormone. It used to be thought that, and this is why people got put on growth hormone, is that they thought that the pituitary gland had no growth hormone left. That's why our levels dropped. They found out that there was plenty there. It just wasn't being stimulated. So these peptides stimulate your pituitary. It releases growth hormone. It actually releases it quite physiologic because growth hormone is released periodically throughout the day and at night. And that's what these peptides do. They stimulate its release throughout the day. And it generally does not raise it to above normal levels, what are called superphysiologic levels. That's where you can bypass that a little bit by taking growth hormone. You can get higher amounts. The typical thing of how you would see that is bodybuilders or really big athletes, they're taking excess growth hormone. They're just getting lots and lots of muscles, way more than they would with testosterone. But growth hormone by itself, or IGF-1, those two things are used interchangeably, has a lot of beneficial effects. It really helps us feel better, look younger. It really is very powerful for anti-aging, as long as we stay within the therapeutic ranges. It's very safe to use. One of the things is, which makes it a little bit annoying as things is, it's by injection. So peptides are given 5 out of 7 days a week. So is growth hormone if you use that. And then we typically will monitor your IGF levels on some people to make sure it's not getting too high. But we want to, and people notice benefits pretty quickly. Tesamorelin is probably the most aggressive for bringing it up. People notice benefits within about 2 weeks. Growth hormone, CJC, and Somorelin, that takes 3 to 4 weeks to about that time before people start to notice those levels go up and then manifesting. People start leaning down, seeing much more vascularity, more muscle definition, visceral fat going down, start noticing skin integrity way improving, skin's getting thicker, people start to look a little bit more younger. So the question is, do older people benefit? Yes, that's the selected market for that. So that's our Med-Minute question for the week. Remember to submit some more so we have something for next week.